The sacred nature of the family informed the prioritization of its privacy for the longest time in human history. The need for privacy effectively informed recommendations by law enforcement to minimize involvement in domestic issues. All this changed with the popularity of the women's movements in the 70s that focused on female victims of domestic violence, thereby primarily presenting men as the perpetrators. The efforts by the women's rights movements guided increased arrests for the perpetrators of domestic violence, as well as the establishment of so-called treatment programs for domestic violence perpetrators. Men were primarily punished by law and/or sentenced to mandatory involvement in the treatment programs, while women were sent to established shelters. According to the 2004 report by the National Clearinghouse on Family Violence, there are thousands of domestic violence treatment programs in the United States, and over 200 in Canada. These programs and interventions are founded on the attribution of domestic violence to the perceived patriarchy in the family and the society as a whole. The involvement of the patriarchy and domestic violence has informed its presentation as a male crime, with women only perpetrating violence within the context of self-defense. The presentation female-perpetrated violence as primarily based on self-defense warrants the examination of available evidence on the symmetry and perpetration rates. Strauss and Scott argue that there is symmetry in perpetration, low prevalence of self-defense, symmetry in coercion and control, and symmetry in other risk factors. This table shows the rates of male and female perpetration in various studies as documented by Strauss and Scott. Fiebert documents two meta-analyses, both demonstrating that women are as physically aggressive, or more, than their male partners in heterosexual relationships. The first meta-analysis, published in 2004, examined 155 scholarly investigations, which included 29 reviews and 126 studies. The aggregate sample size in the articles was 116,000 respondents. Just to run through a few of the studies, Eisenman and Kelly uncovered similar rates of self-reported perpetration of domestic violence between men and women. Arias and colleagues found that more women engaged in severe physical aggression than men. Bernard uncovered that 21% of women and 15% of men reported abusing their partners. Bohannon and colleagues revealed that 7% of husbands and 11% of wives reported physically abusing their partners, and Buchweiler maintained that 55% of men and 34.3% of women reported being victims of intimate partner aggression, among others. Fiebert published an updated annotated bibliography in 2013, which contained 343 scholarly investigations, with 73 being reviews and 270 being empirical studies. The updated bibliography, just like the previous one of 2004, revealed that women were as physically abusive as their male counterparts, if not more, in the context of heterosexual relationships. The cumulative sample size for the updated annotated bibliography was more than 440,850 participants. A quick run through some of the studies, Eisenman and Kelly uncovered symmetry in the self-reported rates of perpetrating violence between men and women. Amend maintains that a third of the divorced German men reported incidences of physical abuse during the divorce process, with 2/3 of the abuse being initiated by their ex-wives. Caetano and colleagues argue that Black, white, and Hispanic women were more likely than men to perpetrate intimate partner violence, and Capaldi and colleagues' longitudinal study of 2007 revealed that adolescent and young adult women were twice as physically aggressive as men. The rates of perpetrating violence were mutual in the 20s, and mutual aggression increased the risk of injury for both men and women, among other studies. Fiebert, in the 2004 meta-analysis, also documented Archer's meta-analysis 2002, which uncovered that women were more likely to slap, kick, bite, punch, and throw objects, while men were more likely to choke, strangle, and beat up their partners. Archer's analysis of 2000 revealed that women presented greater likelihood and frequency of using multiple acts of physical aggression compared to men, and they also reported most of the injuries at 62%. Basically, based on the analysis, women were more likely to perpetrate domestic violence, as well as get injured from the violence. The analysis also revealed that the female perpetration of intimate violence was minimally predicted by male aggression and was prevalent among dating couples. Archer's study of 2006 uncovered the presence of symmetry in the perpetration of domestic violence across 16 developed nations. The extent and direction of perpetrating intimate partner abuse was dependent on the variations of women's empowerment and individualism collectivism. Noteworthy, reduced female victimization and increased male victimization were linked to an increase in empowerment and individualism. A second analysis conducted across 52 nations uncovered an inverse relationship between gender equality and individualism and the rate of female victimization. Attitudes towards wife-beating also affected the prevalence of women being victimized. The findings in the 2006 study were replicated in the 2013 study, which reported that women empowerment is associated with women being as physically aggressive or more than men. Apart from symmetry and perpetration, Strauss and Scott argue that half of domestic violence is mutual, a quarter is male-only perpetrated, and a quarter is female-only perpetrated based on the National Family Violence Surveys of 1975 and 1985. Besides, the International Dating Violence Study conducted across 32 countries revealed that mutual violence was the most dominant by characterizing over two-thirds of the cases, with female-only violence being more prevalent than male-only. A common argument when it comes to female perpetrated is that it is out of self-defense. However, this is rarely the case. Particularly, Cascardi and Vivian's study of 1995 uncovered that wives used more severe or extreme violence in self-defense, with self-defense accounting for only 20% of the female perpetrated violence. The findings by Cascardi and Vivian are supported by Follingstad's study of 1991, which revealed that the motivation of self-defense only characterized approximately 18% of intimate partner violence. Overall, Strauss and Scott argue that self-defense as a motivation for perpetrating violence only accounts for about 20% of all the violence-related cases. Strauss and Scott maintain that the risk factors, such as social skill deficits, including anger, communication, and negotiation issues, personality disorders, mental health issues, and poverty, that inform the perpetration of violence among men and women present more symmetry than asymmetry. Noteworthy, Strauss and colleagues' study of 1980 revealed that social factors that affected the prevalence of violence in families, for both parents and siblings, include race, residence, religion, employment, income, and age. Persistent conflicts eventually became violence, and the safest homes have 2 or less children. Strategies used in reducing violence discussed in the study include counseling, both individual and marital, family planning, court and police intervention, child welfare services, daycare services, and shelters. The framework developed by Swan and Snow highlighted various motivations for female perpetrated violence, including the popularized self-defense, traumatic childhoods, coping with relationship issues, and the outcomes of mental issues and substance abuse. Noteworthy, post-traumatic stress disorder contributes to maladaptive coping strategies, including poor problem-solving and avoidance, which guides women's choices of being involved and remaining in violent relationships. Strauss and Scott argue that the only consensus, at least based on research, when it comes to intimate partner violence is that women are more likely to be injured, or even die. This consistency supports the continued support for female victims of intimate violence, but it should not come at the expense of men accessing the relevant services or managing the perpetration of violence by women. Especially considering the prevalence of mutuality and intimate partner violence and the increased risk of injury and death in bidirectional violence compared to unidirectional violence. Society, in using the battered women syndrome and self-defense, largely supports female-perpetrated violence, even if it leads to homicide. The prevalence of intimate partner violence ranges from 1 to 16%, with most of the violence being among young dating couples as documented by Strauss and Scott. The authors also note something very interesting along the lines of a reduction in the prevalence of violence is associated with increased likelihood of injury. In other words, studies that identify men as the primary perpetrators are characterized with increased frequency and minimal injury. Johnson divided the types of violence into situational violence mostly originating from an escalating conflict, intimate terrorism characterized by fear and control, violent resistance which is retaliation and intimate partner terrorism, and mutual violence and control which is exactly that, mutuality and expressing controlling behavior.